Here's what's impossible when it comes to an honest review of Medicare plans. Now, I want you to imagine this assignment that I'm going to give you. Give me an honest review of cars. And I'm not going to specify a year, make, or model, just vehicles in general. There are currently 130 brands and just over 7,000 models of vehicles right now. Guess how many Advantage plans exist in America right now? 4,000. And even though there are only 10 supplement plan letters, every state has different costs with a bunch of different insurance companies that offer them, so the conservative estimate is 3,500 different supplement plan combinations, bringing our total count for Advantage and supplement plan options to 7,500. 500 more plan options than we have total models of vehicles. So in this video, I'm going to review all 4,000 Medicare Advantage plans nationwide. I'm joking, that's impossible. In this video, I'm going to give an honest overview of how Advantage plans work in general. This will be much more like a review of cars in general, as opposed to cars and trucks and vans and tanks. You get my point. Now in high school, my sister drove a 1976 Ford Pinto, and I don't know if anyone watching will even know what that is, but the Ford Pinto made it on the list of the worst cars ever made because, among other things, it had a tendency to erupt in flames if there was ever a rear-end collision. So in all fairness, there are some real Ford Pintos out there from an Advantage plan perspective. There are also some very nice what we'll call Cadillac plans out there that are amazing, and a whole lot of what we'll call Toyota Camry plans out there. So even though it's not an American car company, I'm going to work off of the Toyota Camry idea rather than the Ford Pinto or the Cadillac idea for these plans. If I say something that applies to a Toyota Camry type plan, but you've heard the horror stories of the Ford Pinto plans erupting in flames, we both need to understand that a Ford Pinto and a Toyota Camry are not the same. Okay, you won't hear any more car references from this point forward. Let's get into this. There are 6 categories that most people look at when they are picking an insurance plan. Okay, the first topic here is how much will the Advantage plan cost you in monthly premiums? The answer is most likely $0. The Kaiser Family Foundation puts the number at 73% of all Medicare beneficiaries pay $0 in premiums. There are plans that have premiums, but most pay $0. This is where Advantage plans shine, and if you're skeptical around how am I getting something for nothing, the insurance companies are paid by the government to take over the risk of original Medicare. Instead of Medicare having to pay its part of your healthcare claims, the insurance company takes on those payment risks in exchange for money from the government for every person that the insurance company has on their plan. Now, the amount that the insurance companies get is not standard. It depends on a lot of factors, and for this video, we're going to say it's $1,000 a month per person or $12,000 a year. This is not an exact figure, but we'll need it for a later point in this conversation that we're having. So Advantage plan premiums for you, the consumer, are great. Now, unless you're on Medicaid, you will still need to pay for the Medicare Part B premium. An Advantage plan doesn't eliminate that. In 2024, the base premium is $174.70 per person per month, or about $2,100 per year, and that goes up for those with higher incomes. And commercials and people in the comments will say, well, wait a minute, some Advantage plans will give you Part B buybacks. Yes, these plans exist. They are an exception. They are not the Toyota Camry. Okay, that is the last car reference. Most people still have their full Part B premium that you need to pay despite the $0 Advantage plan premium. Okay, topic number 2 is what do the plans cover? Advantage plans cover your hospital stays and your medical procedures. That's replacing original Medicare Part A and B respectively. Advantage plans must cover everything that original Medicare covers, but they do not cover it in the same way, and that's coming up in the last section. Most Advantage plans also come with prescription drug coverage, dental, vision, and hearing coverage. So yes, Advantage plans come with a lot of types of insurance coverage all under one roof. Okay, topic number 3 is all about out-of-pocket costs. How much will you need to have available to pay when you need to use the healthcare system? These costs will come in the form of deductibles, copays, or coinsurance. The deductible is the dollar amount that you have to pay before insurance starts to help out at all. Most Advantage plans do not have a deductible. Some do, most don't. The deductible is important to understand though because it'll come up in a minute. A copay is a fixed dollar amount that you pay for a service. For example, you go see a specialist, $30 copay. You get an x-ray, $10 copay. You go in for an outpatient surgery, something like a knee surgery, $350 copay. So a fixed dollar amount that varies by plan. Coinsurance is a percentage of the bill. A common one here would be chemotherapy. You would have a coinsurance of 20% for chemotherapy. So you're responsible for 20% of the costs of those treatments. It's not a fixed amount, it's a percentage. Now you pay copays and coinsurance up to a maximum out-of-pocket, and as the name suggests, this is the maximum dollar amount that you would need to come up with in a given year. Once you meet it, your insurance company will take 100% of the remaining costs for that year for any approved services. Now, the average maximum out-of-pocket nationwide is about $4,200. The lowest we've seen is around $500. The highest allowed in 2024 is $8,850. These are for in-network services, which I will cover networks here in a minute. The one-year total out-of-pocket risk, using the assumptions that we have had, including the Part B base premium, is at around $6,300. These maximum out-of-pockets reset each year in January, so if you have something really expensive happen, say in October, that carries over into the next year. Your max out-of-pocket will reset in January, and now you could have 2 years worth to worry about in a relatively short amount of time. Now, here's why we bring up a deductible, and maybe this isn't you, but a lot of people confuse a deductible with a maximum out-of-pocket. High deductible health plans are very popular as work insurance plans that many of you have had through your employer. You've had a high deductible that you need to pay first, and then insurance starts. And then you have some sort of a max out-of-pocket with your company plan before Medicare. Most Advantage plans do not have a deductible, so hitting that max out-of-pocket is much more difficult to do than the max out-of-pocket on a high deductible health plan through work. The lack of a deductible with most Advantage plans is a very important benefit. Okay, the fourth topic is the network. Which providers and facilities can you use? You have a network with Advantage plans, and the two main network varieties are an HMO, which stands for Health Maintenance Organization, or a PPO, a Preferred Provider Organization. There are other network options, but these are by far the most common. In general, HMO networks are tighter networks. If you visit an out-of-network provider, the claim is denied by your Advantage plan, and you are responsible for 100% of the costs. We've seen instances of people having covered blood tests denied, come to find out they went to an out-of-network provider. Many HMO plans require a referral first before you see a specialist. In exchange for these tighter networks, in general, HMO plans have lower maximum out-of-pocket costs than PPO plans. PPO plans work a little bit different. In general, the network isn't as tight. A big difference is that PPO plans have out-of-network benefits. So if you visit an out-of-network provider or facility, the claim isn't denied and you aren't responsible for 100% of the cost. It will be a higher cost to you than an in-network provider would be, but it isn't 100%. It might be something like a 30% coinsurance. Now, PPO plans typically come with higher maximum out-of-pockets than HMO plans. Providers can drop from the network mid-year, meaning when you check for participating providers for this coming 2024 year, you may find your doctor is in-network, which is all well and good, but your doctor can choose to leave the network mid-year. Certain systems like the Mayo Clinic have publicly stated that they do not accept most Advantage plans. So the point is, Advantage plans have networks. It is important to understand your network and use in-network providers, much like the employer plans most people have been on their entire lives. The last thing to mention in this section would be the emergency care. If you have an emergency outside of your coverage area, the Advantage plan is required to cover that as in-network. Now, it must be a true emergency and coded as such by the hospital or provider. But if you're traveling and you have an emergency happen, you do have coverage through these Advantage plans. If it is not an emergency, it'll depend on your HMO or PPO arrangement. All right, the fifth topic to cover would be other perks. And I'm not going to spend a lot of time on this because there's a lot of variety here, but many Advantage plans come with other perks like gym memberships, over-the-counter benefits where you get a dollar amount for certain items, grocery benefits, rides to and from doctors, and other things. These are the things that are hit on hard in ads and commercials. You will hear some pretty crazy benefits out there. Please know that these wild plans are, number one, not available to everybody. The benefits are often only available to a specific set of people in specific zip codes, so they're not available to everybody. And number two, these plans are not available everywhere. The crazy plans are usually only available in specific states, again, in specific zip codes, and the ads are designed to get you to call a call center, and they will try to move you to a different plan, usually not the plan that you tried to call for in the first place. Now, personally, I wouldn't get a plan based solely on these other perks. They can be nice to have, but the other points in this video have a larger impact on your physical and financial risk. In fact, we are to our last category, which is the one that will cause the most drama. Let's talk about how easy it is to use the plan when you need it. Advantage plans are managed care plans. This means a private insurance company is managing your care in an attempt to be more cost effective. Remember how we spoke about the dollar amount that the government pays to the insurance company to take on the risk? Well, the knock on the Advantage plan is the perception that the insurance company won't pay for anything. The claim is that they will deny care so that they can keep as much of that $1,000 a month amount that we used as that example. The misperception is that the insurance company will never lose money on an individual. This is not correct. Insurance companies lose a lot of money on individuals, but their hope is that the overall collective of the people that they insure does not lose money, because more people cost far less than the dollar amount allocated per year than those who cost more. And look, every insurance company out there has heartfelt slogans and initiatives around helping patients and providers make more wise decisions, and there is some truth in that. But to say that profit is not a motivating factor would be incorrect. So we need to talk about how prevalent these prior authorization denials are. Let's look at the data that's available to us. In a study of all available prior authorization requests in 2021, which is the most recent study that we could find of this magnitude, 6% were denied. A more narrow study in 2022 put the inpatient level of care claim denial at 5.8%, so very close to that 6% number. For context, the denial rate for the same claims across all other payer categories, meaning everything not an Advantage plan, is 3.7%. Now let's go with the New York Times article in 2022 that caused a lot of discussion. The conclusions were that 13% of claims denied by Advantage plans in the set of data that they looked at should have been approved. Now, there were a lot of problems with this study, as well as the conclusion that this article drew from the methods of this study. If you really want to dive into it, I have a link in the description, but let's take it at face value. Independent reviewers, human beings, went back through all of these denied claims looking to see if some of them should have been approved. The outrage over 13% of claims denied that should have been approved is completely warranted. Denying claims for medically necessary care is unacceptable. Now let's look at the other side of that number. 87% of claims that were denied in this sample should have been denied. Again, according to independent reviewers hired for this study to look for specific claims that were denied and should have been approved. So the reality of the healthcare system is that there are a lot of factors happening here that are contributing to denials. Know that with all Advantage plans, you have the option to appeal a denial. And in the much more complete study in 2021, of the denials that were appealed, 82% were overturned either completely or partially. Now, everyone loves to hate Advantage plans. Some of the biggest Medicare videos on YouTube right now are those bashing Advantage plans. And most of the presenters are agents that also put people on Advantage plans. Advantage plans are an easy target to get people riled up. And here's the part where most of the hate comments come in. Just because I say anything positive about an Advantage plan, or I cite studies that don't fit the belief system of those who hate Advantage plans, the immediate conclusion is that I or any other agent sharing this information is insert an attack on our character here. I'll address this after I wrap up this section. So the bottom line with Advantage plan administration is that the insurance company has a say in your healthcare decisions. It is managed care, again, much like many employer and individual plans that millions of people experienced before Medicare. Okay, here's the point that I hope you take from this video, and then I'll address the money incentives for agents. Medicare Advantage plans are not for everyone. Right now, just under 50% of Medicare beneficiaries are covered by a Medicare Advantage plan. The major reasons we see from people is the lack of monthly premium, all of the coverages that we talked about that are part of the plan, and the other perks that we discussed. For some, these things are what are most important to them when picking health insurance coverage. For others, those are not what's most important. And once this decision is made, there are ways to switch, but they can get complicated. We have an entire video dedicated to that, so go watch that for details. Now, many people watching this will be on Advantage plans right now, so for you, I hope this helps clear up how they work. Now let's go over agent incentives. In general, Advantage plans offer higher commissions to agents for the first year that somebody goes on Medicare. So if you're on a supplement plan G right now, and your agent switches you to an Advantage plan, the commissions are comparable, especially if you have a drug plan and a dental plan with that supplement plan G. The real commission difference in many areas and with many insurance companies is for that person going on Medicare for the first time. That number is public. It's not a big secret. For 2024, in all states except 6, it's $611 for the first year. The renewal, so years 2 and on, it's $306 for a year. That's not a month, that's a year. And the way many agencies work are the agent gets a part of that, and then the agency takes part to cover the overhead expenses. Let me make this as clear as I can. If an agent is pushing people to Advantage plans solely for the higher first-year commission, that is wrong. A good agent will do what is best for you, not a short-term commission. Retention is how we can continue to provide for our family in this business, not putting clients on plans that are not in line with their values and losing clients only to try and replace them over and over again. We have a big issue with that, as well as the misleading marketing that happens out there with commercials and call centers pushing Advantage plans as something that they're not. Advantage plans are not original Medicare. They do not work like supplement plans. They have their strengths and their weaknesses that anyone going on an Advantage plan should know about. An agent's responsibility is to educate you on how these and other plan options work, and then you can decide what suits you the best. I didn't talk a lot about supplement plans in this video because we'll have a video like this on supplement plans right over here. And while much of the Advantage plan information will be repeated, we have this video right over here that talks about both supplement plans and Advantage plans. So check that out for more about the supplement side of the conversation. I will see you over there.